I want to thank Helene Gale for her leadership at CARE, and I want to thank each and every one of you for supporting CARE and for supporting CARE's life-saving work. Thanks to all of you for your warm welcome. I'm happy to be with you tonight to celebrate 65 years of CARE's work around the world. And I'm especially happy to join you all today to mark the 100th International Women's Day. In the early 1900s, women from around the world came together to champion the rights of women and to ensure equal opportunity for women worldwide. They raised their voices to proclaim a principle that we all now accept as universally true. The success and progress of free societies depends on the participation of all citizens, men and women. A century of progress has shown us that when you educate and empower women, you improve nearly every other aspect of society. As the great Egyptian poet Hafez Ibrahim said, when you educate a woman, you create a nation. Today, women are leaders in addressing some of the world's most pressing problems, from literacy and education to health and human freedom. And when you look around the world, you see that women are at the forefront of life-changing progress. Mothers in Africa are making great strides to combat HIV/AIDS and malaria. Afghan girls are back in school, and women are inspiring the dissident movements in Burma and Iran. Education is essential for women's empowerment. We know that literate, educated women are more engaged members of society. The impact of women is far-reaching, from their homes, through their communities, and in their countries. They teach their children. They talk to their neighbors and share stories with their sisters. They're more likely to participate in business and trade, which leads to greater economic development. Literacy enables women to ask questions, to understand their rights, and to participate in their governments. Sadly, though, women still constitute the majority of nearly 800 million illiterate adults worldwide. The benefits of empowering women through education and literacy are evident in Afghanistan today. In 2001, fewer than 900,000 boys and no girls were enrolled in Afghanistan schools. Today, more than 6.2 million students are enrolled in Afghanistan schools, and 35% of them are girls. Although these are signs of great progress, many challenges remain. Young girls are persecuted on their way to class. Newly opened schools have been vandalized or destroyed. And in many rural areas, those who dare to teach girls receive letters threatening not only their lives, but the lives of their children as well. Last spring, George and I hosted the U.S. Afghan Women's Council at the Bush Institute in Dallas at SMU. And the conference was educating and empowering the women and girls of Afghanistan. One woman speaking at the conference, Dr. Sakina Yacobi, spoke with great passion and conviction. At great risk to her own life, Dr. Yacobi operated underground literacy centers in Afghanistan during the years of the Taliban. Today, she runs more than 40 women's centers across Afghanistan, providing hundreds of thousands of women with literacy and health classes. Dr. Yacobi encouraged conference participants to invest in Afghanistan's future, to support their ongoing progress. Yes, it's difficult, she said, but be patient with us. Don't be sorry for us. Be with us. I'm proud to stand with Dr. Yacobi and women from around the world who are champions of women's rights. And we're supporting them and many others through the Women's Initiative at the Bush Institute. Through this integrated initiative, the Bush Institute is working to provide women's rights and empower women by enhancing education, advancing economic opportunities, encouraging civic engagement, and improving women's health. We know that the lack of education is an obstacle to good health, especially for women. And studies show that educated women raise healthier families. Girls who have the opportunity to attend school, delay marriage, and choose to have children at an older age when their bodies are more developed and able to survive childbirth. And the likelihood that her child will see his or her first birthday increases up to 10 times when the mother survives childbirth. And educated mothers are better equipped to determine a family size that best ensures a loving and healthy family. Too often, girls raised in poverty are given in marriage as children and become pregnant as teenagers. And complications of pregnancy is the leading cause of death for girls aged 15 to 19 in the developing world. In many countries, maternal mortality rates could be drastically reduced by simply improving access to prenatal and postpartum care. In the absence of midwives and doctors, women die from causes that do not need to be fatal, and which usually are not fatal in developed countries where standard care is often. We've seen significant advances in childhood immunizations and in the treatment of HIV and malaria, and we need the same progress of life-saving interventions for mothers and their newborns. Simple and inexpensive solutions for high blood pressure, excessive bleeding, and obstructed labor could cut maternal deaths in half. By providing women and families with the chance to make decisions about family size that's right for them, the number of maternal deaths could be reduced even further. Through our Global Health Initiative at the George W. Bush Institute, President Bush and I are working to improve the health of women and their families. We know that women are most likely to go to the doctor when they're pregnant, and in some cases, it might be the only time they seek health care. The strategy of the Bush Institute is to use this time as an entry point for delivering comprehensive health programs to families. The Bush Institute initiative will work with the host governments and partners on the ground to screen new mothers for disease, to provide them with medicines and information on how to prevent the spread of diseases. They'll be taught about nutrition and the importance of hand washing, and provided with other important items like bed nets to protect against malaria. Without medical treatment, HIV-positive mothers have a 1 in 3 chance of infecting their children. Yet these odds are reduced to less than 2% with a few simple measures. The Bush Initiative will help make sure babies are born HIV-free. The knowledge that mothers will gain during their health visits will improve and sustain their health, as well as the health of their children in the years to come. The focus is on the individual herself rather than on a specific disease. We've seen the benefits of strong partnerships to address other global health challenges, from public funds to support AIDS relief, to private donations of bed nets to prevent malaria. These programs have produced dramatic results and saved millions of lives. Similar investments in comprehensive maternal health care could save even more lives today and then for generations to come. Tonight, as we observe the 100th International Women's Day, we celebrate the progress that we've seen thanks to a century of women raising their voices. We applaud their courage and their sacrifice, and we recommit ourselves to addressing the inequities that still affect women around the world, especially illiteracy and poor health. We look forward to the day when every mother and sister, wife and daughter is educated and empowered and healthy enough to fully participate in society. We know that achieving this goal will require global participation at every level, from international organizations like CARE to individuals in every home. So thanks to each of you for all you do on behalf of women worldwide. There may be times when you wonder how one person can make an impact, but let me offer a story Jenna told me from her trip to Ethiopia. There, the government has led an effort to create a countrywide, community-based primary health program. In every village, community-based health extension workers are working closely with families, especially women and mothers, teaching them about the values of healthy living. Families who adopt healthy living standards are recognized as model households throughout their community, which is a very effective way of encouraging others to do the same. In one community, though, the women noticed what women notice all over the world. The men weren't being helpful. So they created a set of criteria for a model husband. A model husband keeps the home and its immediate surroundings clean. A clean home prevents the spread of infectious diseases. And of course, all the men wanted to be recognized as model husbands. So thanks to the initiative of these women, more and more men have adopted model behavior. Their innovative efforts are now being replicated throughout Ethiopia. And their story reminds us that one woman's influence can make and affect a dramatic change. Thanks very much to CARE for hosting this conference and for 65 years of helping people around the world. And here's to 65 more. Thank you all very much. Thanks so much, everyone. Thank you all, and God bless you. Thank you. Thank you so much.